Hi, my name is Zach Splinter. I'm a student physical therapist at the University of St. Augustine. Can I get your name and date of birth, please?
Jacob Aguirre, May 23rd, 1995.
Okay, and can I check your wristband? All right, cool. So essentially what we're doing today is you're here because you have some pain with your upper left trap.
Yeah, it's just kind of hurting a little bit.
Okay, and you, from what I understand, you hurt that yesterday at work?
Mm-hmm.
Okay, so kind of what I want to do for this is I want to do an ultrasound treatment because I think that'll help reduce your pain. And it's going to do this by a couple different ways. It's going to increase your pain threshold, which is going to, in theory, reduce your pain. It's going to increase cell permeability, which is going to help reduce swelling. And then it's going to increase tissue extensibility.
Okay.
So does that sound like something you'd be okay with today?
Yep.
Okay. So before we get started, I want to go over some precautions and contraindications of ultrasound. So just let me know if you have any of these conditions. Do you have any joint implants or anything like that?
Nope.
Do you have any infection that you know?
Mm-mm.
Okay. What about, do you have any cancer? You can't be pregnant. Do you have any tuberculosis?
Nope.
Hemorrhagic conditions, DVT, or myositis ossificans?
Mm-mm.
Okay, so because you don't have any contraindications or precautions, I think we can go ahead and get started with the treatment here in a second. Before we get started, I want to go ahead and get your pain on a scale of 0 to 10, 10 being the worst pain you've ever felt. What would you say your pain is at right now?
Like a 6.
Okay, so it's a little painful right now.
Right.
Okay, so the first thing I want you to do, if you don't mind, do you mind taking off your shirt? Okay. I'll take that for you. And then if you could go ahead and lay on your stomach for me with your head right there. So the first thing I'm going to do is I'm going to inspect the upper trap area. Everything looks okay. Doesn't appear to be any redness, infection, no lesions there, so I think we're good there. And then before we get started, I want to test for sensation because a precaution for this is impaired sensation. So what I'm going to do is I'm going to take this cotton ball here and I'm going to brush it against your cheek so you know what it feels like. Okay?
Mm-hmm.
So I'm just going to basically touch on areas around your upper trap, and I want you to say yes when you feel the cotton ball.
Yes. 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 Yes.
Okay, great. It appears that your sensation's intact. So now that I've done the skin inspection and sensation testing, I think we're ready to get into the treatment. So I'm going to go ahead and put this gel right here on your upper trap. Is that about the area where you're having the pain?
Mm-hmm.
Okay. So before we get started, I want to let you know about the treatment parameters. So I'm going to do 1 megahertz because it's muscle, so we need to get a little deeper. And then I'm going to do a pulsed mode and at about 15%. And this is because it's an acute injury, so we're doing this for a non-thermal treatment. And then we're going to do this about 1 watts per centimeter squared. And the treatment's going to be 10 minutes. So if you have any discomfort or if anything feels off during this, you may feel a little warmth, but that's normal. But if anything feels abnormal, you start feeling any pain, please let me know. So I'm going to go ahead and start this. Okay, it's been 5 minutes, so I'm going to go ahead and pause. And I'm going to inspect the skin. Everything looks okay. Does it feel okay?
Mm-hmm.
Okay. I'm going to go ahead and start this again. Okay, and it's been 10 minutes. So I'm going to go ahead and get this gel off for you. So, you feeling all right?
Mm-hmm.
And on a scale of 1 to 10, what would you say your pain level is now?
I don't have any pain.
Okay, and it looks like your skin's okay. Great. So, looks like the treatment worked.